Bom dia, buenos dias, good morning, everyone. Thank you so much for being here. On behalf of our president, Dr. Leonor Bleza, I want to extend to you a warm welcome to the Champalmo Foundation, a house of knowledge and of care. We're also extremely pleased to be co-organizing this event, hosting the International Congress on Neurodegenerative Diseases here at the Champalmo Foundation, together with Fundación ICND, Fundación Reina Sofía, and the Fundación Champalmo. I hope that you enjoy Lisbon, the beautiful sunny weather of this area by the river, and I hope that you'll get to have many fruitful, intellectually stimulating conversations in the next 3 days. I know you want to get right to business, so for the opening remarks, I would like to call up on stage our very own John Krakauer from the Champalmo Foundation and Pascual Sanchez Juan from Fundación ICND. I'll see you in a minute. Wherever you want.
Should we do a duet?
Yeah.
So welcome everyone. My name is John Krakauer. I'm a neurologist and neuroscientist. I'm here at the Champalmo. Welcome to our spaceship, those of you who have not seen it before. And also thanks obviously to the Queen Sofia Foundation, ICND, and the Champalmo. I'm just going to make a little comment about what I think this meeting is going to be about. I was at the ADPD meeting here in Lisbon earlier this year, and back in the US, I have a lot of friends sort of in this field. I'm not an AD or PD person. And it was noticeable to me that there was a little bit of optimism in the air with respect to sort of earlier detection, beginning to see signal in the new drugs, especially in AD, with lecanemab and donanemab. And also, I think, a realization that in conjunction with these new glimpses of light in the pharma domain, that non-pharma interventions, non-invasive, invasive brain stimulation, behavioral interventions are also becoming quite exciting as complements to the pharmacological approach to neurodegenerative disease. So I hope that this meeting will really show that the armamentarium has expanded and that we can begin to maybe combine these different approaches and basically have this multiplication between better stratification, earlier detection, and bigger effect sizes with these different modalities. So I'm actually quite excited to see what happens over the next few days. Thanks very much.
Bienvenidos, bienvenidos, welcome. Well, first, I would like to thank our friends from the Champalmo Foundation for the co-organization and hosting of this meeting in such an amazing place. We're lucky to be here again, so thank you very much. And yeah, I think I'm even more optimistic than John. I've been treating patients with neurodegenerative diseases for more than 20 years, and I would say that this is the most exciting time I have lived by far. I think that we know more about the mechanisms of the disease. It's not that we can distinguish which individual is going to have Alzheimer's disease or Parkinson to the other. We have no clue about that, but I think definitely we have advanced, and we now know that this is not a linear process. Probably it's more complex, there are more components, and we have more pragmatic approximation right now. And this is what we are going to see from the neuropathology, from the genetics, and how this translates into the clinic, because this is starting to translate into the clinic, in the diagnosis, and hopefully in treatment. So to talk about all these issues, we have one of the best experts in the world. So we are really happy with the program, and we thank all of them for being here with us. And just to finish, I just would like to wish you a really memorable meeting here in the beautiful Lisbon. Thank you very much.
Thank you, John. Thank you, Pascual. For the first session of the day, it's my pleasure to introduce to you Alberto Rábano, who is the Director of Neuropathology Unit and the Brain Bank. Alberto, I took note of our conversation at Fundación 100. Alberto will guide us through the session on neuropathology, exploring together with the panel of speakers research mechanisms behind neurodegenerative diseases, structural changes and molecular signatures in the brain leading to cognitive decline. Alberto, the stage is yours.
Hi, thank you very much. Thank you very much, and welcome to everybody to this conference, to this marvelous venue. This is the second time that we visit this fabulous place. And I would like to start also thanking the organizers for this kindness, I could say, with neuropathology. Neuropathology, I mean, we are used to be more or less at the end of things, at the end of clinical pathological meetings, and but indeed this time we are at the beginning, which is, and I think that is something meaningful for this, for the ideas that are around this conference. So as I say, this session will deal with neuropathology. At the end, we will go even deeper into lesions, into cells. So we will have open a window into what's going on within the cells. And well, I will take just a few minutes to introduce the issue, how we see it, how we are familiar with it, from our center, from Fundación 100, and our own cohort. So if I have the first, I think I don't know how I move the, I think. Yeah, that's it. So this is our center. This is Vallecas. This is Vallecas, the Alzheimer's Reina Sofia Center. It is like this. Yeah. We're in Madrid. We're in the southeast of Madrid. It's a very well-known neighborhood in Madrid, Vallecas. And well, this is a very special center. It's a very large nursing home, monographic for dementia patients, sponsored and built, organized by Queen Sofia Foundation. And our center, our research center, is within the nursing home. It was a very special way of approaching, of bringing together basic research and translational research into close to the patients and the relatives. And that's what we do very briefly with the patients, with the patient that enter the cohort. We take lots of clinical and functional and neuropsychological data for years. For the whole time they stay with us. We take every year or every 6 months also blood and other biological samples. We get brain donations of a significant percentage of patients, and we have a very last generation 3 Tesla MR, and we do a lot of pre and post-mortem, also post-mortem magnetic resonance studies. So this is these are data of our first 167. Now we have over 170 recently. But what we are processing the brains. They are mainly female, very high age at death, and this is a very predominant Alzheimer's, first Alzheimer's disease as neuropathological diagnosis, followed by vascular dementia, dementia with Lewy bodies, and other less prevalent causes of dementia. Well, we are always discussing how representative is this cohort of the population. Of course, it has its own bias. And well, we have been focused for some time now on studying all co-pathologies, and well, this is a representation of each patient with each one of these pathologies and the intensity of these pathologies as the height of the bar. And well, it's just a way to see it, and this is way also that we use. These are the main diagnoses that we have already discussed. This is a combination of Alzheimer's and vascular, which is as we see the most frequent oh, sorry. I think I pushed the wrong button. Yep, sorry. Very close. Yeah, that's it. Yeah, you see here, this is Alzheimer's, blue, and this is red, vascular. These are the predominant. Therefore, we study the wow. No, that's it. We study the combination of Alzheimer's and vascular, and here, this is Alzheimer, pure Alzheimer. This is main Alzheimer, pure Alzheimer, and here we introduce Lewy body disease, so this is pure Alzheimer, and these other combinations of Lewy body disease and vascular. And another way to look at it is the number of co-pathologies. We use different strategies to identify high burden co-pathologies, total co-pathologies, or only clinically relevant co-pathologies. And well, as you see in this type of old, late life dementia, we have these very high frequencies of co-pathology. Well, this is our own setting. We are doing lots of deep phenotyping studies and omic studies in this cohort, and